assemble my equipment. Hello, my name is Desi. I'm going to be your student nurse today. I'm going to provide privacy and I'm going to wash my hands. I'm going to go ahead and scan your bracelet. Can you tell me your name and date of birth? Do you have any allergies? Okay, everything matches up. So today I have an order for a nasogastral tube. Have you ever had that done before? Okay, great. So you're aware that it's a little uncomfortable. All right, so I'm going to go ahead and sit you up in a high Fowler's position. If my patient is in a coma, I'm going to sit my Fowler's with a pillow behind the head. Okay, so have you ever had any kind of nasal surgery or trauma that I need to know about? Okay, and have you ever had a risk for aspiration? Okay, and I would also check that in the patient's medical records for history, in their history. So I'm going to go ahead and look up there. Okay, so I'm going to go have you hold one nostril in and breathe in and out, and the same thing with the other side, breathe in and out. Okay, great, everything looks good. I'm going to go ahead and have you open up your mouth, and I'm going to check your gag reflexes. Everything's good there. Can you tell me where you are in the year it is? Okay, great. So now I'm going to go ahead and listen to your abdomen. Right lower first. All right, great. Okay, so before we get started, I'm going to go ahead and set up a signal with you just in case that it gets intolerable and you need me to stop, okay? So if you could just stick up your index finger if you need me to stop where I'm at so you can get yourself, you know, together, and then once you are ready for me to continue, go ahead and put that finger down and I will continue. Okay? All right, so I'm going to go ahead and pull this out. Wash my hands real quick. All right. So when I pull this out, I'm going to go ahead and assess for any kind of sharp points, breaking, obstructions, make sure that everything looks good and everything's great. And now I'm going to go ahead and measure this from the patient, from the nose to the ear, from the ear. That's a process. And I'm going to flag that. Okay. I'm going to go ahead and make sure this stays up here. Go ahead and lubricate. Alright, so what's going to happen is I will tell you when, but I'm going to go ahead and give you a heads up so you know what to expect. But I have a drink with a straw here, and I'm going to tell you when I need you to take your chin and put it down to your chest and turn slightly and take a drink. Every time you take a drink from me and swallow, I am going to keep going in, okay, until I get to where I need to be. Scoot you a little bit. Open this up. I'm going to go ahead and place this right here just in case there's any kind of secretions. Okay, so I got everything set up. I'm going to go ahead and get my tape set up so I can have it when I'm ready. I'm going to get my temporary piece of tape, and I'm going to get my 4-inch pants. Okay. I'm going to move this over here. Put on my gloves. wash my hands, put on my gloves. All right, do you have any more questions for me before we get started? All right. Okay. So I'm gonna go ahead, start inserting. So you're gonna feel it. Maybe. There it goes. All right, so I'm in the back of the throat. I'm gonna go ahead and give you your drink. I'm gonna have you swallow, 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 swallow. Good job. Okay. Alright, I'm gonna pull my piece of tape off if I can get it. Looks like 2 pieces of tape stuck together. Okay. All right. So now that I have it, and then we'll move this cup out of the way. I'll try to get this out. Okay. I'm going to go ahead and listen for placement. All right, I hear the air bubble. And then my second part of placement is checking for gastric, so I'm going to let go. All right, and it's filling up with gastric fluids. So. All right, and then I'm going to go by the hospital's policy with this, but I'm going to go ahead and remove it. A little sticky. Okay. All right, since we checked for placement, I'm going to go ahead and get my other piece of tape here. Go ahead and secure the tube. We don't need such a long piece of tape. Make sure it's 4 inches. All right. Okay, great. And then I'm going to make sure this is above the patient's waist. You should just put it above the patient's waist. All right, do you feel comfortable? All right, so and if an order for an x-ray is put in, I will go ahead and get that done as well to check placement. And then I will remove everything, throw away my trash. Okay, I'm gonna wash my hands. I'm going to make sure I document. I'm going to document, placement, where it was located so I can check every shift to make sure it hasn't came out or been pushed in further. How the patient tolerated the procedure, how everything went. And then I would also make sure I document if I've started giving fluids and medication, that if there's signs and symptoms of aspiration. All right. Wash my hands. Goodbye, privacy.